I'd like to move to the next slide. And again, 48,000 tests have been run in Ohio. Next slide, please. A quick note on our death count. Again, we have 142 folks, and it's still very difficult to tell much from this death data. We know the deaths are lagging the cases and the diagnoses by quite a bit. We do have deaths as young as the 30 to 39-year-old age range, and again, still skewing older. We are seeing our cases are a case leans slightly more female, not much to call, but we're seeing something that is being seen around the country. We don't know the answers yet on this, but we see that deaths are definitely leaning more toward males. And that is something that's currently being investigated. Next slide. Deaths by race. We have a little bit of data. Again, such small data sets to be working with, but we just want to share with you what we know. We'll have this on our website. Deaths by race, 61% white, 27% black. There's a huge part of our race data, which I'm going to show you more of now, where we just don't know. We don't have that delineated. Similarly, we have a little bit on ethnicity. Next slide. Let me tell you a few things about race and ethnicity as we know them today. 25% of the cases that are being recorded in our database do not have race noted. A full 39% do not have ethnicity. Many times this data is collected on intake. It's a patient given, a patient offered information. So unfortunately, people are opting out of filling out that part when they're being admitted to the hospital. So the hospitals are giving us that data that they know, but we really need folks to fill that out as a way of getting some of the data. What we do know by race, again, our cases are 51% white, 18% black, 2% Asian and Pacific Islander, multiracial 1%, but a full 25% we just don't have the data on, and that's an issue for us. It's an issue we faced all along in reporting of diseases. Ethnicity, similarly, non-Hispanic, non-Latino is 58%, Hispanic Latino is 2%, a full 39% of our cases we just don't know. So we are working very closely to capture this. We're trying to help our hospitals, encourage folks to fill out that data. I know some people are uncomfortable filling that out. It's a choice that's made, but it's very, very important. You're hearing a lot of reports nationwide, and a lot of questions about this. Even before coronavirus, we know that there are huge disparities in health outcomes in this country. And some of those very same issues that have faced us before the stress of a pandemic, we know have a chance of being greater exacerbated. This is something that our local health departments on the front lines take very seriously. They're passionate about the social determinants of health and ensuring equity. They're very passionate about health and all policies. So they are working closely with their civic leaders, they're working closely with hospitals, with nonprofits, to ensure that no one is left behind in this illness. And this is a daunting challenge for us. Right now, it's very hard for us to say much because we're only testing, again, the sickest and highest risk individuals. One of the things we're working on is the second we have testing, being able to do widespread testing of the population, the mildly ill, the asymptomatic. And it's crucial that we do that in a way that gives us a very good picture across all populations. So not only by race and ethnicity, but we have to take special attention for those who are disabled, for the elderly, for folks that are dealing with life-threatening illnesses. There are a wide variety of ways that we need to ensure as we respond to coronavirus that we leave no one behind. So this is something I take very seriously. I always have. We've dealt with these disparities and differences in life expectancies and outcome on a number of issues, infant mortality and maternal mortality, just to name a couple. So we really want to take this seriously as we try to give out resources in a pandemic. And I will continue to share with you what we know as we know it. These are important numbers for us to follow.